So week 6 is all about respiratory. It's all about cardiac. And let's see what you all have due for this week. So week 6, you're going to be doing your first CJ Sims. I want you to be careful. They're worth 5% each sim. You know what that means? Make sure you get your best grade. Make sure you get it in on time, okay? These really will affect your grade overall. And if you noticed, right now your homework grades are on. So it will be reflected in your grades. Overall, everybody that I met with improved. Math had improved. There was one question, and that's what Roland got wrong, because it was twice a day and you gave me the daily dose, not the dose. So it was a trickier question, but many of you didn't see that. So we'll go over that and we'll look at that again. So let's go ahead and do a cahoots. Let's get it done, get out of here so y'all can enjoy your Friday and I can go celebrate a little bit with my daughter. I think she might want
Professor,
to do that. Yes.
you said that they wanted the daily dose or just the one-time dose?
It was a dose of milligrams per kilogram, and they sent you something, but it was delivered in two doses daily, and it asks for how much would you give per dose.
Oh, okay, okay.
So that was the one that was confusing. As I said, I know that this is the ones that are going to hit you, and it's okay. I mean, it's again learning now with these exams and then not making those mistakes when we get into our Hessian NCLEXs, right? Because this exam, you guys really, I mean, you blew it out of the water. Make me proud. I might even have a glass of wine tonight, and I don't drink. I'm going to celebrate for you.
I got another class. I can't.
I'm sorry. So there are 30 questions. So let's see how many we can get in here. And I should get them out in about 20 minutes. And then you'll have time to sit out a little bit, relax before your next classes. And Roland, you can pat yourself on the back. That was amazing.
Yay, Roland, you go.
I mean, the grades were
Thank you.
amazing. Now,
Thank
you
you.
will be getting your grades tomorrow about before 1. Okay, I'm meeting with the group tomorrow. And we're going to go over maybe that question and see what do we think? Was it written correctly? Could have something else been done? And we look at things very carefully.
Professor, I'm gonna sit out of this Kahoot.
That's fine.
I'm gonna ice my knee. Thank you.
It's okay. Please ice your knee. Feel better. So respiratory and cardiovascular and hearts are my strongest suit, believe it or not. So acute coryza is another name for what? Now, this is a definition. I know most of you have been studying and you didn't look at the chapters, or maybe you did or tried, but this is a name that you need to remember.
Yes.
And it's a common cold. Coryza, see, common cold, coryza. It's just
Perfect.
another name.
I think of it like coriza in Spanish is
Okay.
sneeze. So when you sneeze, when
Yeah. Yes, you do. Acute croup is also called. Now, croup is an upper airway issue, and the epiglottis covering the larynx gets a little bit swollen, and it creates a barking cough. So it's upper airway croup, and it's inspiratory stridor, laryngotracheal bronchitis. Excellent. So which term is used when describing the collapse of an alveoli? Well, where is an alveoli? I mean, and this usually happens post-operatively when patients don't deep breathe and cough, right? That's why we encourage ambulation, we encourage that deep breathing and coughing, and we medicate them before so they can do it. is called atelectasis, okay? Wheezing is basically asthma, because you have a lot of wheezing in asthma. What is tachypnea? What does tach mean? And pnea, what do those mean? So take the word apart and tell me what you got.
Fast breathing.
Tachycardia, tachypnea, increased respirations. Very good. So think tachycardia, and bradycardia. And you'll also see apnea, which means A, without breathing. You see that a lot in infants. What will the nurse teach the child with cystic fibrosis to take to facilitate digestion of nutrients? Now, cystic fibrosis has something to do with mucus and clogging of lungs, number one. And number two, the pancreas does not secrete enzymes to digest, and fats are lost. So these children need a high carbohydrate and a high protein diet to make up for it. And we give these pancreatic enzymes immediately before snacks and for meals. And it helps them break down the food so that it gets to the body. Nutrition. When a child has a fever and an upper respiratory infection, what should be included in the nursing care? Well, what do you know about fever? What do you know about upper respiratories? What do you think about? I think about fluids. I think about, dilating those secretions. And I also think about fever making them comfortable, because a fever isn't dangerous once they have it, but you feel horrible. And once the fever is taken care of in children, they go from a kid sleeping on the couch up and running around, and then they're drinking and eating, which is what you want, because fever burns fluid. So those are the two. Asthma causes what? Common childhood disease, which is an expiratory wheeze. It's bronchial hyperresponsiveness. Some sort of allergy usually creates it. My husband has horrible asthma. He actually was in the ICU for 12 days a couple of years back and couldn't breathe for 12 days almost. And I didn't let them intubate him. So it was only from the grace of whatever you believe in that we didn't intubate him, and he's never been back to the hospital since. So he's got a good nurse, right? So increased doctors, increased school absenteeism. Absolutely. This kids, being around children with other sort of upper respiratories, it can spark that asthma. And of course, increased hospitalizations. What is the most common reason for pneumonia in infants? Yes, infants do get pneumonia. So RSV, respiratory syncytial virus. What is respiratory syncytial virus? It is a common cold for you and me. But on an infant who wants to suck, swallow, and breathe, it's a little fever, so they feel miserable, and it's mucus. Now, mucus may not be a big problem, but infants breathe through their noses. So how can you suck, swallow, and eat? So it is the most common. They'll swallow it and it will become a pneumonia. Which congenital cardiac defect causes increased pulmonary blood flow? Well, you need to go back and look at your anatomy about the heart. And we know that the right side doesn't have oxygen and the left does. So whenever the left side gives extra flow through a hole to the right side, that's when you have increased pulmonary blood flow. Makes sense, doesn't it? So you have a hole between the atriums, the septum there. You have a hole between the ventricles, And then PDA is the fetal circulation, and it connects pulmonary artery to the aorta, and the aorta pumps it back into the lungs. So that is those. A child swallows frequently after a tonsillectomy and adenoidectomy. What might this indicate? Remember, kids go home. It's just a day surgery, and they go home immediately after. And we need to teach our parents this. This could be dangerous. I've actually seen a child post TNA 7 days post TNA. She took the clots, the scabs that were on the side of the throat, and after a doctor's visit, I guess one dislodged, and this poor little girl was throwing up like liver clots of blood. She went hemovolemic, which means she lost a lot of blood. I had to run her into the trauma room and get IV fluids in her right away, and she went to surgery. So swallowing is your key clue. But remember, never put anything in that mouth, nothing that's going to create more swelling or dislodge that clot. So signs and symptoms of respiratory distress. This is a broad concept. And I'm going to give you a little bit more than that. So they're not breathing well, so they're getting confused because they don't have oxygen. That's the confusion or restlessness. When the lungs have any sounds, wheezing, rhonchi, rales, all of that is occupying space or not allowing oxygen to flow, respiratory distress. Tachypnea, tachycardia, retractions. In infants, nasal flaring, and you might even hear at the end of a breath a grunt, like a when you see that in an infant, that child's about to code. Bradycardia, if they're getting there, that child is about to have a cardiac arrest. So the tachycardia is actually what you want to see. What is an acceptable oxygen saturation for a child? I mean, what are you taught about adults, especially like a elderly? Isn't it over 92 or 90, especially with COPD? Well, what is it for infants and children? What is that number? And it's above 90. Remember, it's like the big circle of life. It's the end and the beginning. There's so many similarities there. So same thing with adults. The parents of a 3-month-old cystic fibrosis child wants to know how their child got the disease. Neither parent has cystic fibrosis. When both of them are carriers, then they'll get it. You need both of them to be a carrier, and then they have it. What's the first symptom that we see if we never knew? You have a newborn infant born. They're going to be an infant that does not have a stool in 24, 36 hours. And when they don't, they're going to be looking for cystic fibrosis. It's one of that signs that you do see. Which fluids are most appropriate for a 5-year-old child with asthma experiencing dyspnea and fluid loss? And I'm telling you, it makes a difference what they eat or drink at this time. It makes a difference how cold or warm a room is. It makes a huge difference. Everything should be room temperature. Cold tends to spark and cause bronchospasm. Cold rooms instead of just the normal one, too cold. And room temperature. You see in season change, children with asthma will be having asthma attacks. How long after a smoke inhalation injury are patients at risk for pulmonary edema? And that could be a drowning too. Lungs are injured. I mean, in South Florida, I would think more of drownings because I live in South Florida, but it's the same thing for both. And it's 72 hours. These children, like for instance, they drowned, they come up and they resuscitate right away and they're running around and then rescue gets there. They still take that child to the hospital, to the ER, and the parents are like, why? The kid's fine. No, because they could have a delayed response up to 72 hours later. These children, O2 saturations will be monitored for that, looking to see if their lungs stop working, basically. So what findings are expected when measuring the blood pressure on all four extremities on a child with coarctation of the aorta? Think of coarctation as a kink, a narrowing. Blood can't go down. So it goes back and it can't go down. So you're not going to feel pulses in the lower extremities, but the ones up top are going to be more. So it's lower blood pressure because it can't get there, and it's higher on the uppers. Very good. What type of diet should a child with cystic fibrosis be eating? I told you on the first question with the pancreatase for each meal. Remember, the pancreatase and the problem is they don't digest fat. Fat is out the stool, and the stools are oily and really foul smelling because they don't absorb fat. So if you can't get fat, what do? Well, we want them to have good protein. Carbohydrates are also good, but why high in sodium? Well, cystic fibrosis, the salt just oozes out of the pores, and they diagnose it with a sweat test, which measures sodium basically on the skin. So you never take that salt shaker away because they're losing salt like crazy and protein to help replace the fat calories they're not getting. Blood flow between vessels of the heart is called. When it goes from that high pressure left side over into the right side because there's a hole in the atrium like ASD or the ventricle of VSD. What's it called? What's that name? And it's called shunting. Atresia is an absence of a valve and you don't move. For instance, the right atrium and ventricle in between is the tricuspid valve. Sometimes that valve does not form, and it's called a tricuspid atresia. So blood does not go into the right ventricle, into the lungs. It's a big surgery for those children. What is an atrial septal defect? You know this now. So an atrial septal defect is an opening between the right and the left atrium, the upper chambers. And what would be a ventricular septal defect or a VSD? An opening between the right and left ventricles. Why do children with tetralogy of Fallot favor a squatting position? And these are your older children. Tetralogy of Fallot is when the pulmonary artery, something flaps, it closes, blood can't go up into the lungs. Now in infants, we do knee chest because it changes the pressure in the abdominal cavity and the chest cavity, and it opens up the valve and starts the blood flowing. Children just all of a sudden go right down and squat, and it helps that blood to go back through that changing of pressure. Which comment by the parent of a 1-month-old infant would concern the nurse about a possible congenital defect? Now, when you have a congenital heart defect, the heart's not working the way it should. Oxygen isn't getting the way it should. So what would you see in a child that heart is working, breathing up fast, breathing, fluid filling in the lungs sometimes? Well, this child's going to get tired really quick and they're not going to eat. And one of the things that we find that alert us to a cardiac problem after birth that we don't know is not gaining weight because they tire out. They're not getting nutrition. What does the nurse explain that a ventricular septal defect will allow? VSD. It's the hole between the right ventricle and the left ventricle. What does that allow? Remember the right side, blood just gets back there, right? And that's the end of a heartbeat. And the left side, you got left ventricle pumping. That's the engine pumping blood around. So you have high pressure on the left side. It forces it to the right, and then you have increased pulmonary blood flow. And because blood is flowing, increased pulmonary flow, you don't have any cyanosis. Your O2 sats are good. What is a non-invasive procedure to determine if a heart is structurally normal and to find a murmur? Non-invasive. I mean, an infant comes in with a possibility of a congenital heart defect that we knew at birth or later on, and we hook them up to the EKG monitor, and immediately we order this test, and it's called an echocardiogram. We can see if there's holes where the flow goes and all those things. And once we get a positive echocardiogram, they will be scheduled for a cardiac catheterization. Rheumatic fever causes which inflammation? Now, rheumatic fever is a byproduct of a strep throat infection that we didn't treat right away. And then it allowed to sit in the body a long time. So it's a strep infection. It likes to affect the heart. It affects the skin with rashes. It affects joints, make them swollen. And it also affects movement, that the chorea is awkward movements where you can't control them. But everything can be cured with a long-term antibiotics. Whatever you would do strep for, could be augmentin, could be a good one, or zithromycin, whatever the doctor wants. But if the valve, usually mitral valve, is affected, you don't reverse that. But everything else turns back to normal. A child recovering from rheumatic fever needs to receive monthly injections for 5 years of what medication? Well, I told you rheumatic fever is due to a strep infection. Which one here would you use for strep? That's how you look at that question. And it's penicillin. Prednisone is an anti-inflammatory, and Zosyn is an IV antibiotic. You're talking injection. Usually that is given IV piggyback. What life-threatening illness is caused by H. influenza that causes swelling just above the vocal cords? Vocal cords, upper airway, oral pharynx airway, right there. H. influenza, and it's a virus, and it's called epiglottitis. Epiglottitis is when the epiglottis gets so inflamed that you can't breathe, you can't get air in. It starts with croup, and if we don't treat it, it gets more and more swollen and more of that airways covered, and you cannot breathe. It's dangerous, epiglottitis. The nurse should prepare for emergency intubation when caring for the child with what diagnosis? What did I just talk about? Big, swollen area, air's not going in, airway is your number one concern. And that's epiglottitis. Makes sense to you now? You always, as a nurse, make sure you have airway there, whether it's to be intubated or do a trach, because sometimes they can't get nothing in. Asthma, on the other hand, they can't get it out. That's why it's expiratory wheezing, expiratory problems. Epiglottitis, croup, it's in. They can't get it in because it's swollen, covering the larynx. How do you treat primary hypertension on a child? And yes, children do have high blood pressure, and it will affect kidneys and many other things, just like adults. And we are starting to check blood pressures on younger and younger children routinely, where we didn't years ago. So we want them to get up and get out and move. That's number one. But number two is the DASH diet. It's just decreasing the salt and increasing more vegetables, et cetera, in it. And we call it a DASH diet. What congenital heart disease is diagnosed with an aortogram? What did I tell you about the aorta and those blood pressures? What did I call that? Aorta? What is it? And it's called coarctation of the aorta. Aortic stenosis is just a narrowing of the aortic valve. That coarctation is that gram that looks at it. And we can see that kink and how kinked it is and how little dye can get through. It shows you how severe it is. Early signs of congestive heart failure. I mean, you're going to see this with coarctation of the aorta, right? Blood can't go down. It's going back into the left ventricle, left atrium, and then it pools in the lungs. So we're gaining fluids like crazy. And the heart's saying, I'm really giving up here. This is getting to be too much. And it is all of these. Because you are not flowing the blood, you're retaining it, you're going to gain weight. So daily weights, intake, output of all cardiac children, very important. And because their lungs are with fluid and the heart's not working well, they're going to get very tired when feeding. They're going to be losing weight. Tachycardia and dyspnea, that has to do, the heart's trying really hard. The lungs are trying to breathe fast, but still there's minimal space. What is the difference between HDL and LDL and their cholesterol? How do you know the difference? Let me tell you how I remember these. HDL is healthy cholesterol, and LDL is lousy cholesterol. That is the difference of what they do. And HDL means you're not going to have a plaque that clogs up everything that creates heart attacks. It's an easy way to remember it. Hyperlipidemia is what? What does that mean? Hyper means a lot of. Lipids are what? They're fats. So too much fat, simple. Now, which answer is it, right? So it's fat and fat-like substances. It's just not fat. Yes, very good. And our last question, we made it. A hypoplastic left heart syndrome involves the underdevelopment of what? This is probably the most severe of all your congenital heart defects. And it's left heart. So which one of those is left? Which one could it be? And it's the left ventricle. So the left ventricle does what? It's the engine of the heart, right? And it pushes the blood around to the body, and it gets thickened and it don't work good, and blood doesn't flow right. These children undergo 3-stage surgeries. They go multiple cardiac catheterizations. They're under really close observation by their cardiologists. And many of them end up with transplants, heart transplants, because their heart just can't do anymore. Now, it's not the most common of all congenital heart defects, but it is the most intricate, involved one of all of them. So let's see how we did today, guys. Number 3, Chrissy. Good job, Chrissy. Number 2, Amanda. Good job, Amanda. Number 1, KH. Who's a KH today?
Me.
TW and your. Good job.
I finally made it.
Yay, Kim.
You know, we did it
Thanks.
today. So remember, I will be getting your exam grades back to you by tomorrow, by noon. Again, thank you so much for being a stellar class and so understanding about starting late and then the issues that occurred. But you know, that's nursing, working together.
Mhm.
You could see how I pulled resources. Everybody came and everybody was patient. So thank you. I appreciate you. And I'll see you all next week. Anyone 78 or less or 98 or less, doesn't matter. You want to review your exams, you know, give me a holler. I'll meet with you. I'll show you. So thank you, class. Have a good night.
Thank you.
You
Bye.
too. Good night.
Thank
Way to
you.
go,
Night,
Norwood.
night, Professor.
Appreciate it.